Welcome everyone, and thank you for joining us. I know we've got people from all around the globe, and so it's all different times of the day, so thank you so much. I know for some it's evening, some it's a very early start in the morning, so thank you all so much. It's great to have you with us today. My name is Stacey Pigeon. I'm the Research and Policy Manager for Royal Lifesaving Australia in Sydney, and I'll be your host for this event, celebrating women in drowning prevention. Before we start, I'd like to acknowledge the First Nations people here in Australia and also around the world for their continuing connection to land, water, and community. I acknowledge elders past, present, and emerging, and First Nations people who are with us today. So just a few housekeeping points for those who have just joined us. We are recording today's webinar. I've already had a number of inquiries, as I know it is incredibly early in the morning for the Americas and a few other places. We will be making it available in the next few days, so don't worry about that. Again, very, very appreciative for those who could make it, and we will be sharing this far and wide. Can I ask you to please put any questions in the Q&A and comments in the chat function? Links are going to be added to the chat for more information as well. And please feel free to say where you're from and that sort of thing. But sit back and enjoy our wonderful speakers. But firstly, why are we here? So International Women's Day was Tuesday, the 8th of March. And so it's really about celebrating and acknowledging the contribution of women in drowning prevention at all levels. And I'd like to acknowledge there are, in the photos you can see there that were spread far within our sector on Tuesday. There are definitely men in those photos and men championing how to break the bias in our sector and within the drowning prevention field. So we'll be talking a little bit about that with our speakers today. The theme is equality today for a sustainable tomorrow. So our speakers will be looking at that and we'll be talking to that this evening or throughout our event. But today we're going to hear from 7 wonderful speakers from across the globe, from all different backgrounds and roles within drowning prevention and water safety. We're going to have 3 short panels, so you'll hear from all 7 speakers, and then we're going to bring everyone together at the end. So that's how this is going to work today, sorry. And to start off with, we're going into a panel around leadership, so broad leadership. And it is my absolute pleasure to welcome our first 3 panelists, who are all very accomplished women from across the drowning prevention and life-saving world, coming to us from the UK, Norway, and Australia. So I welcome Dawn, Catherine, and Claire, who are, some of them are very early in the morning and some in the evening. So as a way of a bit of an introduction, I'd like to introduce Dawn Whittaker, who has many roles. The first being her day job as the Chief Executive of the East Sussex Fire and Rescue Service, the National Fire Chief Officer lead in the UK for water safety and drowning prevention. But she's also the chair of the UK National Water Safety Forum, which Dawn was actively involved in the development of the UK National Drowning Prevention Strategy, which was launched back in 2016. Her passion is community safety, helping to educate and ensure the public understand risk and stay safe. So welcome and good morning to you, Dawn. We also have joining us Catherine Greaves, who's the CEO of Lifesaving Victoria here in Australia. Catherine has an extensive background in behavioural science, law and governance. She's held roles in local and state government, as well as in health, education and emergency services in both the regional and metro settings. Catherine was appointed as interim CEO of the Country Fire Authority in 2020, before taking over the role of CEO for Lifesaving Victoria last year. Catherine champions the importance of values-driven and people's-focused leadership and engagement. Thank you for joining us, Catherine. And Claire Ann Alfonso is the president of the Norwegian Lifesaving Association. This is a role she's held since 2015 and has been on the board of the International Lifesaving Federation, both at the international level and in Europe as well. So Claire Ann is an attorney by trade. She runs her own company focusing on safety management and legal advice. And Claire is currently undertaking a master's degree in management, focusing on risk assessment and safety. So thank you all very much for joining us. So we're talking about leadership in this first section, and I'm really interested to hear about some of the leadership opportunities, as well as the challenges that you all may have experienced, more broadly or within the drowning prevention sector. So I might start with you, Dawn. You've got an extensive background in the fire service in the UK, which has traditionally been, I guess, a male-dominated sector, as well as being chair of the UK Water Safety Forum. So can you share a little bit about your experience with us?
Yeah, sure. Hi, and good morning, everybody from the UK. So I guess the key point is you're absolutely right. I work in the Fire and Rescue Service, and it is generally male dominated. In the UK here, we have about 6% of our workforce that are women. Operationally, it goes up when we're talking about support roles. But of course, it's what the public see, seeing is believing, isn't it? It's what the public see that can be very influential. So, you know, my part as a chief exec of a fire and rescue service is absolutely about breaking that bias, challenging those stereotypes, and ensuring that anybody that is interested in community safety can play a part. And you asked to the challenges. So they come from all levels, actually, not just internally within the cultural sort of predominant ethos that exists within in fire and rescue service, which is a bit of a male bastion, but also, I guess, from partners that we work in. Even the uniform itself can be a little bit of a challenge at times in terms of engaging with people. And apologies for having it on, but I'm at work straight away after this. Also, I guess the last point I'd like to make, and I guess that lots of you on the call this morning might recognise that, is influencing upwards. So getting the government involved and engaged in anything. But as a woman, I feel we have great tenacity as women, and also use our communication skills and our natural networking ability to perhaps, you know, galvanize some of those conversations. So yeah, I guess that would be my initial thoughts.
Thanks, Dawn. Really great thoughts to start off this webinar with. Catherine, would you like to tell us a little bit about your experience in terms of challenges and opportunities?
Sure, thanks, Stacey. And look, I relate to a lot of what Dawn said, but I have to say, when we look at what we've achieved in gender parity at Lifesaving Victoria, it's actually pretty amazing, with 50% of our membership, around 40,000, being women, and also with our board and our executive as well. But in saying that, let's be really honest and start peeling back the onion. And when we get into those operational roles and those leadership roles, we don't have that same level of parity. So for us, this is absolutely a challenge, and we need to break down some of those stereotypes and definitely empower women. And we've got a lot of work going on in that space. But I think the importance of bringing men and boys along the journey as well is just so incredibly important. And I think we know that more often than not, the bias is actually unconscious. So what we need to do is bring it to the consciousness, but make it not okay. So I think for us, that's a key thing. And this is right across our emergency services in the state as well. So certainly not a new concept at all. I think the other thing too is about myth busting women's assumptions as well. So, you know, and this is where, you know, we have one of our biggest challenges, and we have to actually show some of the results. So past habits, that practice, and the disappointment of continually being overlooked for roles for women can lead to them, being inclined to, I guess, throw up their hands and give up and look elsewhere for other challenges. So I think for us, the really big challenge, and this is right across, all of our services, is to actually, have these positive conversations. This is why we're here today. We need to peel back those layers, take a genuine, honest look at our business, start talking about it, and then really walk the talk. And that means setting some clear vision and targets, not quotas, but I mean actual targets, and then taking really practical steps and actions to do something about it. I think one of the things that I've learned on my journey too is don't try to do it all alone. You'll find that others have really traversed that path before and have some really fantastic strategies for their people to share their knowledge, and a real willingness, obviously, to share their knowledge and learnings as well. So that's why this is such a fantastic forum to enable us to share. But that's sort of some of my key observations of the sector.
Thanks, Catherine. I think you make some really good points, and unconscious bias is something we'll probably bring up and talk about a little bit later on as well, but certainly around the role modelling and bringing people along the journey as well. Claire Ann, in Norway and being president of the Norwegian Lifesaving Association, have you seen some of the, I guess, had some of the same experiences that Dawn and Catherine are talking about? And can you tell us a little bit about, I guess, what's going on in Norway in your situation?
Yes, sure. I just gonna, stand behind what Catherine and Dawn has just said earlier today. But coming from a Nordic country in Scandinavia, where equality has been a huge thing, so I think we're kind of, I would say, highly privileged being a woman in leadership here in Scandinavia, and I think, but there are still some bias, I would say that, and it's probably the difference would be in other culture and society, it's an obvious bias. Here it's kind of an underlying bias. The man still thinks, okay, we're equal with the women, but okay, I hear what you're saying, but you still have that kind of approach with some men. But in my experience, I think one of the importance for us women is to normalize our position in the society. It's normal to be a woman in leadership. And importantly is also not to lose your femininity being a leader. I mean, we don't have to be a man to be a leader. Leading as a woman is as important as it is to being a man. And also the fact that Catherine put up, I think it's very important for us to have along with us our sons, brothers, and husbands and fathers during this process. I think if we normalize it during the upbringing of especially I have two sons, it's very important for them that there's no difference in being a man and a woman when we do something in society. So I think this is one thing I would say, normalize the fact that we are here to stay.
I very much like your point, and I think I mean, this forum obviously supports that most definitely, and I think having women such as yourselves in those leadership positions are showing that it is being normalized most definitely. And actually that leads us quite nicely into the next question I had, and Catherine and Dawn have actually both, and actually yourself have both touched on this already. We've seen lots of positive changes around women in leadership, as you've said. Can you tell us about some of the changes that you have seen in the organisation? You've talked about Norway as being a little bit of a possibly a different situation than what our colleagues in other countries experience. Can you talk about anything that you've advocated for and been successful in implementing? And that goes for both Catherine and Dawn as well, but I'll let Claire talk about that to start with.
I think in terms of, I mean, we are a small organization here in Norway. We have, as you can see, due to our weather, we only have lifeguards on the beaches during the short period of the summer. But one of the things that I think has been good for us is the fact that we been working towards in connection of normalizing women in life saving and drowning prevention, is that we hire our lifeguards or even our employees in the office based on their merits, and not only just focusing on the fact if they're woman or man. I think it's essential for us, for those coming into the position is in lifeguarding as well as women, that they got there because of their merit, their competence, the way they can do their job. It's not because of their women, if they're women. And I think that's one of the main focus that we should that we have been working towards here in our organization, and probably also to among the other Nordic countries. And also the thing that I'm really proud of, if you see the Nordic countries, most of the organizations are being led by women. So it's really thumbs up.
It's very inspiring to hear. Thank you. What about you, Catherine? Sort of what changes have you seen or have advocated for? And what have you been successful or proud of, as Claire has said?
And look, Claire raised some great points. For me, having those really honest conversations and being very open and transparent about where we stand on this. So again, you know, and I've quoted you some really high level, you know, examples of terrific gender parity across our membership and organisation. But, you know, when we do start to unpack that, we see something different. So for me, being really open and transparent about that is incredibly important. In saying that, we have some fantastic programs into place, including one that's called Women in Lifesaving, and that's a network that's been running since 2013 and includes a series of leadership and mentoring opportunities to develop and showcase the achievements of really amazing women in lifesaving. So that includes special actual programs and leadership programs, as well as our very, very well attended International Women's Day breakfast, which is an annual event where we bring together emergency services as well, and really, you know, set the tone and example there. So look, I have to say we've done some absolutely superb work, and but I think for me, it's being really honest about where we can do better, and really focusing our energies into that. And I think to Claire's point as well, it's not about quotas or anything like that. It absolutely has to be merit-based, but there's a real, I think in terms of women in leadership in particular, it's a long pipeline, and it doesn't just happen overnight. And what you have to do is plan very early and set those opportunities in place at a very early stage, and set those expectations in place as well. So again, that's some of the work that we're doing at the moment to make sure that we're creating you know, a really accessible pathway for women into those roles as well.
That sounds great. Thank you for sharing that, Catherine. And then for Dawn, what about yourself in terms of changes and things that you've been proud of in terms of implementing those changes?
Sure. Okay, so I'm going to focus, I guess, on the outward facing work that National Water Safety Forum have been doing. And let's remember, because picking up on Claire's point, you know, we are women advocating for men, because in the UK, the vast majority of people that drown or get into difficulty in water are actually guys. So we're absolutely advocates for the guys here. In terms of the work that we've been doing in the UK and in the different organisations that make up the National Water Safety Forum here, we have been instrumental in helping galvanise voices. So organisations like the Black Swimming Association, which are promoting swimming capability and encouraging people of colour into water and to gain swimming competency, are, you know, absolutely fundamental in that. Also, work that we've been doing on autism and neurodiverse spectrum to encourage people and, I guess, make people aware and look at different forms of education to make a broader spectrum of people aware. And the last thing is parents. It's hugely important in the UK. Parents and families are huge advocates, particularly when you think about the parents who may have lost a loved one in water. They absolutely have lived experience and a desire to get out there and to educate and prevent accidents from happening in the water and encourage young people to be safer. And so I think we have helped to facilitate that, but also, you know, the people that go out there and do that work, a lot of them are women themselves, you know, mums, sisters, grandmas in other cases, who have been through that experience and absolutely, you know, are very focused, despite their own personal losses, to have a voice and improve water safety. So galvanizing that, facilitating that, and also actively championing their voices is a really positive, I think. And I'd be interested in hearing from other panelists if, you know, in that, in terms of the outward facing work, more so than the corporate sort of sense of the of water safety and drowning prevention advocacy, whether or not they're also focusing on some of that stuff. Thanks.
Yeah, Dawn, I think you make some really good points. We will be talking about, I guess, the role of males in drowning prevention, and also the fact that males are overrepresented a little bit later on. But you make some very good points, and certainly the research that I've done as well is women are conduits in terms of drowning prevention advocacy as well. So, and actually this sort of links to the next question quite well as well. You're talking about people going and being advocates, whether or not they're women and sisters and mothers and things like that. But we're also talking about making change for the future. So what advice would you give the next generation to change the bias? So both males and females. And I'll start with Catherine this time round.
Sure. Okay. Interesting question. And I like Dawn. I'm a mum of 2 boys. Well, actually 4 boys and a girl in a blended family. But I think, and next gen, so it's very much front of mind for me. And I think next generation will face different challenges to those that I and my generation have faced. But I think many are the same as well. Always my advice to my kids has been: do what you love, do what you're good at, and do what you're passionate about. Get in, have a go, be yourself, be true to yourself and your values, and don't let assumptions and stereotypes put you off. Just set your sights and go for it. And I think things, and again, this is advice that I give to people that I've mentored over time as well. And one of them is also think about who you admire and actively seek role models and mentors in that vein as well, just to really sort of to build that up. And we all know the expression "dare to be different." I say just dare to be you. And my feeling is that it's, in some respects, it's never been easier to be different and to be seen than it is today. And this is still very much an evolving mindset. But I think there's also another thing, and I was reflecting on this the other day with one of my sons. And sometimes I think your role as the next generation is actually to be an educator. So you might actually need to ease the older generation into your ways of thinking. So I reckon there are ways of doing that without, doing a sledgehammer approach, but to actually just educate the older generation, because that's where the change is actually required in so many cases.
Thank you, Catherine. I know I can see Dawn and Claire nodding away there. So Dawn, what about you in terms of advice for the next generation in terms of breaking the bias?
Yeah, I really agree and can empathise. I've got the blended family too, Catherine, 5 of them, but thankfully they're all grown up. So, I don't have to do school runs anymore. So in terms of, I guess, the next generation, I absolutely agree with the educator bit. In terms of break the bias, I'm a real advocate for the UN's he for she movement. It certainly worked in fire, and drawing out those really positive male allies that want to not as Claire was alluding to, be slightly parental about the way they work with women, but actually want to push women to the forefront and facilitate them. We don't need guys to speak for us, but the actual point of he for she is about really positive allies. And one of the things that the other thing that I've done here in East Sussex in England is try and make sure that we use multiple media platforms that are going to appeal to the whole age range. And trust me, I'm not TikTok. I don't do that thing. But I've found by using local students, guys, I mean, really frivolous, I have to tell you. I look at them and I think, oh my goodness, does anybody watch this? But really frivolous stuff down on the beach, it's actually really worked. So use their voices and those younger generation on the right media platforms and make it fun, but have a subliminal message in there about the importance of not taking risks, having fun, absolutely, but not putting themselves in danger. That speaks to people of their generation. So I think that blended approach, multimedia approach, and letting them say it in their own language is really important, because sometimes we think we know the answers because we've been around that cycle, but actually, who's going to listen to me? I'm a 55-year-old mum and grandma. So, using people's voices is really important.
I think you're completely right, Dawn. I see that there's been a comment in the chat around seeing you on TikTok. So perhaps we might see you in the future on TikTok, but certainly using the younger generation and also people that relate to each other to get those messages across are really important. Claire-Anne, did you have anything that you wanted to add in terms of your advice for the next generation and also breaking the bias before we finish up?
Really amazing advices from Dawn and Catherine here, and I totally agree with them. But one thing I can add on is actually the fact that I think it's important for us to own our own value in the market. If I could use that word, being a man or a woman, I think it's really in connection with daring being yourself. You should also know that your value that you put on the table is important no matter what. So, and also that the fact that I hope the next generation will be more into doing what you're passionate about. It took me some years before I ended up doing life saving and drowning prevention. I really love working with law, but drowning prevention is more on my field now. It's something that I'm passionate about. So I hope the younger generation would find their passion earlier on their age, not on their 40s. But it's never too late, right?
It's never too late.
Your value.
Thank you very much, Claire, and thank you to Dawn and Catherine for this session. I think we've got some really interesting thoughts and insights from you all in terms of breaking the bias, but also your experience in terms of leadership, opportunities and challenges and how you've overcome those as well. So a great way to start the event. Thank you so much. We'll move on to the next session where we've got two very passionate speakers as well. And I would like to now welcome Dr. Jagnor Jagnor, who is the Program Head and Co-Director of the WHO Collaborating Centre for Injury Prevention and Trauma Control at the George Institute for Global Health here in Sydney. Jagnor's research interests are exploring the impact of injury, including drowning, assessing the issues of equity and vulnerability, evaluating interventions to best address injury burden in low and middle income countries. And she is currently working on several projects in Australia, Africa, and Asia, working on injury surveillance, road injuries, burns, falls, and drowning. Welcome and thank you for joining us, Jagnor. We've also got Dr. Becky Sindel, who's the International Evidence Manager for the Royal National Lifeboat Association. Dr. Sindel is an international public health researcher with experience in water and sanitation, often known as WASH, injury prevention. She said she learns from failure and risk reduction. So for the last 3 years, up until 2021, Becky was the operations manager at the WASH Research and Development Centre in Durban in South Africa, where she oversaw the day-to-day runnings of sanitation projects in informal settlements and rural households. So thank you both for joining us. I know, Jagnor, it's the evening here in Sydney, and then Becky, it's early in the morning. So thank you both so much for joining us. You've both worked with low and middle income countries, and I'm really interested to hear, I guess, your perspectives in terms of the role of women in drowning prevention efforts at the community level and the barriers that some women face. We'll start with you, Becky. Can you talk a little bit about the communities that you've worked with in Africa? And I know previously you've also been involved with Nile swimmers as well. So can you tell us a little bit about that experience and the role of women in those communities?
Yeah, absolutely. So as you mentioned, I previously worked with Nile swimmers, which is drowning prevention programs in the Sudan. And the RNLI has has programs in Africa, in Tanzania, and has been working in Zanzibar until recently, both of which, so Sudan and Zanzibar, for those who don't know, are quite conservative countries. So there's a lot of expectations about how women are supposed to behave, what they're allowed to do, the way that they're supposed to dress. And sometimes it can feel very challenging to get women involved in water safety. I mean, most of us think of learning to swim. It's stripping off to a not quite a skimpy bikini, but a swimming costume of some description. It's not the most conservative wear, and so it can feel almost impossible to get women involved. But there is a huge amount of interest from women to be involved. There is a huge amount of desire to see their communities be safer. And a lot of the time, they're doing a huge amount of work to have their voices heard at all. And so it's a question of really asking them for their input and finding ways to do that. So, for example, having separated meetings where you meet with men in the community and women in the community separately. Setting those meetings at a time when women can actually come along, so not when they're supposed to be looking after children, for example, or cooking meals, and asking them what are the challenges that you see to being involved, and what are the ways that we can work around those. So it could be things like providing suitable swimwear. So in Zanzibar, the women who are running swimming lessons and the girls who are attending those swimming lessons are wearing conservative swimwear, which was kind of approved by the community. And it's also about saying, where can we find a space to do that training? What can we do to support you to continue with your water safety education when you are menstruating? Because for a lot of people, if you are menstruating, there are a lot of taboos around what you can and cannot do at that time. And so you have to consider, how do we deal with those things? A lot of the time, the women who you are working with, absolutely, they have the answers. They know the workarounds. They've done these things before. These are the communities that they live in, so they know the answers. And most of the time, it's finding and giving them the space to have their voices heard.
That's great. It's a very much contrast from, I guess, some of the things we're hearing about in the first panel from Claire Ann and Norway and some of the other speakers. Jagnor, is that your experience as well, working with some of the countries you've worked with, so Bangladesh and India, in terms of the role of women in water safety and drowning prevention at that community level?
Yes, I would say so. It is quite similar. But before I dive into what the experiences really have been, I think I would like to point out two things. One, taking from Dawn about a bit about ableism and looking outwards. So acknowledging that it's not just gender, but the intersectional lens of prism that we need to have. And for some of the members who might not be very familiar with the term, and also the ones who are familiar tend to use it in very different ways. I would highly recommend Kimberly Crenshaw's TED video of 11 minutes, and she's a civil rights activist from US. And if you're keen on understanding what intersectionality really means, I would really encourage you to have a look at that. And at the same time, if I'm talking about intersectionality, I have to kind of reflect on my own position with communities in the Global South, so-called. And so I'm thankful for those wonderful communities to bring their experiences forward. But it is very much through my lens. It's not my lived experience. And I just hope that I can do some justice and bring that voice forward. So if I have to talk about communities, maybe I'll put it into three different categories. Communities as they experience drowning. Secondly, the way women are involved in delivering or providing implementation of drowning prevention. And thirdly, how programs for drowning prevention are received by these communities. And they're just so diverse. So when we talk about child drowning, I think that is something that most of the people are very familiar with in that geographic region. What we often find is that there's guilt, there's shame, there's a compensating pregnancy happening, and often not in Bangladesh, but even in India, particularly in West Bengal, we see there's alcoholism and there's violence against mothers, and so there's a strong sense of shame and guilt that's brought forward. And if we talk about wash, I think that's again something that is very gendered experience. So as the cultural norms, women go out defecating in open in the dark, which does expose them to greater drowning risk, particularly if they're going by the riverside. So again, it's a different experience. If we talk about disasters, again, there's a fair bit of published research that we have done from Bangladesh, which talks about how women are reluctant to evacuate and do not like being in shelter home because of privacy issues. And over here, I'll talk about intersectionality. So just if we cross the border across Bangladesh to India, say Lower Assam, were brought in from Bangladesh as youth cultivators. And they have this intersectional struggle where their religion and their socioeconomic and environmental disadvantage puts them in odds to access services during a disaster. So I think it's very differently experienced by communities, even though we will say most of the social determinants are quite same. I think it is also very different in the respect that it is implemented. With respect to Anchal, it's a published paper again talking about how there are gender trade-offs every time we have Anchal Mass providing trade services in these communities, and what does really autonomy mean for them. Talking about, Becky just mentioned menstruating, and it was a very eye-opening experience, and the stereotype that I mean, as researchers, we have to reflect on ourselves. So everyone who was providing swim safe in Bangladesh were young girls. However, the moment you went to level up as a manager, they were all males, and then definitely within the cultural context and even in the bigger context, did not feel very comfortable talking about their menstruating experience, and it was a real struggle whether or not they can make it to the swim lesson. I see in the chat box that there's a problem with my audio. Am I audible to everyone, or is it my connectivity? Stacey, I'm going to look into it.
I was going to say you're okay now, but there was some issues with the connectivity before, but I think we managed to hear almost everything. So I think it's okay at the moment.
Okay, then I'll just finish up with the last point, and that is more about who receives the program. What kind of gender equity do we see among child participation when we're implementing these programs within the community? And as we see, there are often drop-offs more among girls as compared to boys. Thank you, Stacey.
Thank you, Jagno. And yeah, we definitely heard most of it, but some really, really interesting points. And I think there's a lot of points there that you don't, or particularly people might take for granted in terms of both swimming programs, but also the wider social determinants of health. And it's not also just about gender, it's about age and religion and cultural barriers and different things like that, that it's not just about gender. And I think that's really important that we need to take into consideration across the globe. And also when we talk about equity and access to programs, which really, it leads me to my next question, is around what does diverse, equitable and inclusive drowning prevention look like? So Becky, I might go to you for that one, or to start with.
Yeah, sure. So I think that an element of this is to do with where in the world we're talking, and that's not because I think that that equity looks different in different places, but diversity does need to look different in different places. We need to make sure that we are putting the people who are most affected by drowning at the forefront of what we do. And as Dawn mentioned, predominantly we are talking about men drowning, but just because those are the people who are drowning doesn't mean that they're the only people that we should be talking to. Every one of those people is drowning in a situation where they are they are part of a community. So it could be that you have fishers going to Lake Victoria in Tanzania to fish for their families. They are drowning, they are leaving behind their partners, their children, and that has a massive impact on that family in terms of where food is coming from, where income is coming from. It has a massive impact on the other people that they're going out fishing with, who may now look at that situation and go, is this something that I really want to do, but at the same time it's still something that I have to do. So we need to look at, again, as Jagnal mentioned, with children drowning, there's often a lot of guilt around the mothers, who are often the primary caregivers, of going that they feel like that was something that was their fault, that they should have been able to stop. And so we need to really make sure that we are considering all of those views, and allow for all of those voices to be heard, so that drowning really is preventable in all the different contexts that we see it happening. I think that, as Dawn mentioned previously, there is a need to see more women in frontline rescue roles. The RNLI in the UK and Ireland has over 500 women on their frontline rescue crews, but there's still a way to go before we have equal numbers of men and women in those rescue teams, and there's even further to go before when you say, draw me a rescue crew for a lifeboat, people don't automatically draw a middle-aged white man with a beard. Like there's still progress to be made in that area. So we need to make sure that we're including people. We need to recognise that drowning prevention is more than just rescue services, and that all of those different roles have value and are important. All of those roles benefit from having diversity of opinion. So that's as Jagnal was saying about intersectionality, it's not just saying we have women and we have men, it's about having people from different socioeconomic backgrounds, it's having people from different races, people who have different life experiences. All of those things help us to better achieve drowning prevention, because while we are excluding large chunks of the population, either because of their gender or whatever other criteria, we're really like tying one of our hands behind our back while we're trying to prevent drowning.
No, I think that's exactly right, and yeah, very, very well said, as someone popped in the chat there. So definitely some room, food for thought, and actually links in very nicely with our next section as well, talking about roles, I guess, in terms of lifesaving and drowning prevention, but also culture as well. So thank you both to Becky and Jagnal, and we'll bring you back at the end for our full panel session. So thank you both very much. So our final two speakers for today's event both come from a research background, but very different approaches from the Southern Hemisphere. I'd like to introduce Dr. Chanel Phillips. She's a lecturer in Māori Physical Education and Health, co-director of the Te Korongo Indigenous Science Research Centre at the University of Otago in New Zealand. Dr. Phillips' research is firmly grounded in kaupapa Māori and draws on the connection between Māori knowledge, why, water, and health, and her passion for water and the importance of the environment for health and well-being culminated in her PhD research that explored Māori perspectives of water safety and drowning prevention. And her research was the creation, or developed the Waipuna, the model of water safety from a Māori perspective. And her framework, the Waipuna framework, now underpins New Zealand's national water safety sector strategy, Wai Ora Aotearoa, Navigating for a Safer Future, New Zealand Water Safety Sector 2025. Welcome and kia ora, Chanel, lovely to have you, and thank you for making the time this evening. Our second speaker for this session is Dr. Colleen Saunders. She's a senior lecturer in emergency medicine at the University of Cape Town in South Africa, where she manages the research portfolio for the Division of Emergency Medicine. In her spare time, she's the convener of the Lifesaving South Africa Scientific Advisory Committee, and is an active member of the Drowning Prevention Committee. She also leads the portfolio for drowning prevention and water safety working group led by the Western Cape Government Disaster Management. Her research interests are focused on injury, epidemiology and prevention, with a specific interest in understanding the burden and epidemiology of drowning in South Africa. So welcome to both Colleen and Chanel. And the questions I have for both of you in terms of your research experience and also your experience on the ground is, can you share your experiences in terms of the challenges and opportunities that you've both experienced with your research, both from a gender and also a cultural perspective? So linking to, I guess, all the other discussions that we've had already. Chanel, your work on Waipuna, your Māori model of water safety and health, it's unique in itself and it challenges, I guess, the traditional mindset of water safety and drowning prevention. So can you talk to us a little bit about your experience with your research?
Yeah, kia ora Stacey, nā te mihi kia koe, tēnā rā koutou katoa. So kia ora everybody, thank you for the intro, Stacey. So my name is Chanel and I whakapapa to the Northern Tribes of the North Island in New Zealand, Ngāti Hine and Ngāpuhi. And that very much grounded me in the research that I was involved in alongside my PhD. And that was looking at understanding Māori perspectives of water safety. When I was a student coming through my master's and then into my PhD, there was very little understanding of what Indigenous and Māori water safety looked like. There was nothing very much in the public literature in that area. And we also have a high overrepresentation of Māori drowning in New Zealand as well. And so I was really, I'm passionate about the water and the natural environment, and I was really interested to try to understand why do Māori have a high drowning rate despite our strong cultural, spiritual connection that we have to water. And through that research, working alongside my Māori communities, I was able to unpack some of those reasons and really just look at what does water safety look like and mean for our Māori communities. And the Waipuna model that Stacey mentioned, that was really the key finding from the PhD research based on all of the kōrero, all of the conversations shared from our participants and our community groups as well. And that was really about, for Māori, water safety was fundamentally how do we strengthen our connection as Māori to the water. And we can do that through understanding our whakapapa connection, which is our genealogical connection and tie back to the water. By understanding our mātauranga, so going back to our traditional knowledge, our histories, our stories about water, and also our tikanga, so returning to those cultural customs, practices and protocols in and around the water. And so that really framed up the Waipuna model. And that was probably both a challenge, but also a great opportunity in itself, being able to really support the aspirations and reflect the kōrero that was coming from our communities and bringing that through the research so that it was strong, it was their voice being shared, and then working alongside others in the water safety sector to really advocate for change in Aotearoa, New Zealand, when we think about water safety and drowning prevention. So yeah, that was a little bit about my journey, Stacey. I hope I answered your question.
No, I think that was really interesting. And also in terms of, I guess the key question is women in Māori communities. When you were doing your research, did you find much, or I imagine that the women in Māori communities would have provided you with a lot of rich information as well in terms of their role.
Yeah, and I think that's probably something that's been mentioned as well. While we have, specific wahine or female and tāne male roles in Māori society, we don't really distinguish them in a water safety space. And so it was a really interesting question when I sort of got posed it was, trying to consider women's role in water safety, because it's the same role that we would have in everything that we do. And it's really about that complementing role that the wahine and tāne bring to the space. If we go back to whakapapa, for instance, whakapapa tells us the importance of women, of wahine in water. And so we can go back to our, our deities like Papatuanuku, the Earth Mother, Parawhenua Mea, the deity of fresh waters, Hine Kirikiri, the guardian of our intertidal zones. There's so much richness in our mātauranga and our Māori knowledge that tells us the important, significant and crucial roles that females played in and around the water. And that very much helps form, I suppose, the role of wahine in water safety and drowning prevention as well.
It's so interesting, Chanel, and I think also from a cultural perspective as well. My next question is probably falling or more directed to Colleen, who her research is, I guess, quite the opposite in terms of looking at statistics among drowning prevention. And we know that males are overrepresented in drowning. It's been talked about already a lot by the other panelists, and there's a focus in terms of prevention strategies on males. Colleen, has your research looked at drowning among women, and did we need to change our approach to prevention strategies?
So I think, as you say, we know that men drown at a higher rate than women. In South Africa, it's about 4-1. But I think, and Becky alluded to this a bit earlier as well, just because that is perhaps a population group that is highly at risk doesn't mean that intervention strategies have to focus only on men. And I think, so we haven't looked very specifically at drowning rates in women or a more detailed investigation of women because it's so low. But I think what we do know is that about 40% of drowning occurs in children. And I feel that in South Africa in particular, that space is very under-recognized. So the role of women and interventions in drowning in that age group has been under-recognized. A lot of our efforts focus on men, so trying to reduce drowning in those men, rescue drowning, things like that. But I feel like we've forgotten that actually the majority of our drowning is children, and in and around the home as well. So I think we've seen in other sectors, so educate the girl child, small business development, the role of empowering women and interventions that target mothers and the knock-on effect through generations of that, of passing down information and just general increased awareness of issues. So I do think that it's a space in South Africa that needs a lot more work. And looking at specifically at interventions that address women and children.
Yeah, I think you've made a really good point, and we've talked about that the whole way through the webinar this evening in terms of looking at different ways of framing it and also sort of involving women at different stages. And Chanel, I think your perspective on Māori water safety in terms of not really having a distinguished difference between men and women was really interesting as well, and bringing in that cultural perspective. So I think from all of our speakers, we've heard different perspectives, both in terms of low and middle income countries, from a cultural perspective, from a gender perspective as well. But I think, Colin, you've made some really good points in terms of looking at children as well, and not ignoring that, although a lot of our swim programs are based and targeted to children, and maybe not a lot of focus on adults either. So I think there's still some interesting gaps across the sector in terms of prevention strategies. And I know we are running out of time. We probably could have spoken about this with all of you for much longer than this. I'm going to bring all of our panelists back together. So thank you, Chanel and Colleen. I think that was really thought-provoking and some really interesting discussion that added to the rest of what our panelists have talked to. But I'm going to bring everyone together and on screen. So if you can pop all your cameras back on, we're going to do what we call a 1 minute rapid fire. So I've got one key question, and it's going to be a challenge to see if you can all get that within a minute in terms of your answers. But the question is, what does break the bias mean to you in the context of drowning prevention? We've already touched on this throughout the event, and you've all got different and unique perspectives. But for you personally, in 1 minute or less, what does break the bias mean to you? And I'm going to start with who's first? Colleen, you're up first, so you're right in front of me. So what does break the bias in drowning prevention mean to you?
Okay, so the clock's running. I think two things for me. I think first, in South Africa, emergency care and rescue services are still very male dominated, particularly the higher you go up in leadership positions. So for me, I think breaking the bias means more women in leadership positions, both as an example for the next generation that women belong there, but also to offer the different perspectives that women bring, and not only women, as Becky alluded to. I think diverse leadership is important. And a second point, I think that's really important here, and I've just made it, but bringing in the voices of our community. So settings like ours, low resource settings, have different issues around drowning, different socioeconomic conditions, and I think we need those voices to be heard, both at a local and an international level. So I think we need to create spaces for those voices, which are often women, to be heard.
Excellent. Thank you very much, Colleen. We will go to Jagnor. What does break the bias mean to you for drowning prevention?
Thanks, Stacey. I might just turn off my camera. Apologies, everyone. I don't want to sound like I'm talking from a water chamber. That's what I've been told. The clock is ticking. So let me just stop my video. Break the bias. I think I have a long wish list, so I'm going to go for 5 points. I think it means better data, which is more holistic, and its account for the true social and mental health burden for everyone within the communities, particularly women, and its compounding effect on the economic burden that is felt more by the oppressed gender. Better interventions that are more forgiving. I think from road injuries we have seen it's not human error is likely to happen, and how do we make our intervention systems more forgiving? Better implementation that is more gender transformative, which enable disadvantaged populations and disadvantaged community members to be empowered. The fourth would be a bit of humility and accountability. And last, I think Colleen also referred to about bringing diversity on platforms such as these. And it is more also about whose knowledge and whose lens are we bringing on these platforms. Thank you.
Thank you, Jagnor. I know a minute was a challenge, so thank you very much. You did very well. Claire-Anne, I'll go to you. What are your thoughts?
My thoughts, breaking the bias in drowning prevention work is actually hearing every voice, no matter where you are from, what you are from, and which background you have. And also the fact that I think it's, being in the drowning prevention, all of us has a genuine aim or goal to do not have drowning as a problem in the world. So the only way we can break the bias is if everyone's being heard and everyone has a voice in drowning prevention. Thank you.
Thank you, Claire-Anne. Becky.
So for me, I think, as I mentioned around diversity, I think there's a lot more opportunity for women, people of colour, all sorts of diverse voices to be involved in drowning prevention. And I think that the important things for particularly the people who are on this webinar is to understand how you can be a good ally to support those people. So make sure that you recognise that you're not always the right person for an opportunity, and maybe pass those on to other people. Don't be tempted to represent people or situations that you don't really understand. and make use of whatever positions of privilege and power that you may have, either based on your gender or your race or your socioeconomic status, to make sure that you are collaborating with those people whose voices really do need to be heard, and then giving them the credit for the work that they really are doing.
Great, thank you, Becky. We'll go to you, Catherine.
No problem. Thanks, Stacey. And Becky, you've got a lovely bird in the background there, I think. Look, I would offer, and given that we're really focused on gender today, but I really recognise, you know, all of those forms of diversity are so incredibly important. But I think increasing the reach and visibility and fostering the growth of our Women in Lifesaving program is really integral to our continued work to break the bias. And just as we talk about the social, health and economic impacts of interacting with water, I think programs like this actually create a platform not only to showcase women's achievements, but to demonstrate what it means to be inclusive. And we know that the more diverse and inclusive we are, the more likely we are to be regarded as a safe space. And that means we're more able then to attract, engage and educate more vulnerable groups in our communities towards water safety and drowning prevention initiatives. Thanks, Stacey. I think I kept that to under a minute.
Thank you, Catherine. Chanel.
So I think break the bias for me means indigenising water safety and drowning prevention. And so what that means, a water safety sector that reflects Indigenous views and beliefs around the water, and a space where our indigeneity, our cultural identities can flourish and thrive. Kia ora, Stacey.
Thank you, Chanel. And we will finish off with Dawn. We started the session with you, and I think it's only right that we finish the session with you. So Dawn, would you like to have the last words?
Yeah, well, thank you. And how do you follow that? So voices is really important, listening to them, but also using them. And I really like what Becky said. Know when to use yours and know when to push somebody else forward. So as a woman, I promise to challenge stereotypes, gender stereotypes, discrimination and bias in water safety, and also to facilitate, encourage and advocate all those that are going to do exactly the same.
Fabulous words to end our session. So thank you all so much. Incredibly inspiring words of wisdom as well to share with our audience who is global. So we had over 150, I think, on the call at one point, and we are going to be putting out a recording as well. So thank you all for your time and for sharing your expertise and your experience and your thoughts. I know everyone has really enjoyed hearing you, and it's, yeah, for me, I feel very inspired and motivated. And it's great to hear all of your voices. Before we finish, I would like to acknowledge all of the women who are playing a role in drowning prevention, whether or not that be in a volunteer capacity or in a work capacity, or as a mother or a family member, but also the men who support us in breaking the bias. I know there's a fair number of people and males on the call as well, so thank you so much. It really does mean a lot. And I think, thinking about some of the things that our panelists have talked about today, how do we amplify that as well? So thank you, I guess, for everyone in terms of breaking the bias going forward. And thank you for the organising committee from the International Lifesaving Federation behind the scenes to make this happen, and also to push it out on, I know there was a big social media campaign on Tuesday as well, and it's been fabulous to see all of those photos come through that we were showing at the beginning of the session. So thank you all for your work in water safety and drowning prevention across your respective areas. And I wish everyone a good day, a good evening, and thank you again very much for joining us.